This gentleman presented to us with non-ST elevation MI, and non-ST elevation MI is a special type of heart attack where the ECG can be normal, or there might be some T wave inversions, but the troponin is positive. Generally, such patients are diabetic, or such patients generally reveal extensive coronary artery disease. So in this case, we're looking at the RCA. We've already hooked the RCA. The radial artery was already punctured somewhere else, not at our hospital, and it was not palpable. So we had to go for a femoral access in this one. And you can see when I'm pointing the mouse, there's about 80 to 90% stenosis right here in the distal RCA. The RCA isn't very good looking, to be honest, and the blockage is starting from here till here. It's a diffuse disease between 70 to 80% of the RCA, and you can get a closer look in the cranial view that it's a tight lesion right here. It's a 90% stenosis. This is 80% about, and so we're going to take the patient for angioplasty and stenting. To be honest, it was quite a not a very easy wiring because of the large side branch, and so anyways, we used BMW wire, our workhorse wire, and we're trying to measure the lesion, and this is it. Some pre-dilatation is in action right here. We're using a 2 by 12 mm balloon. This is a semi-compliant balloon, and we've inflated it at 8 atmosphere of pressure. Now we can already see some concertina effect right here in action. You can see nothing to worry about because we already have the cine without the wire anyway. So we used a 2.75 by 12 mm stent right here, and we've expanded that 2.75 mm stent, and we're post dilating it with the stent balloon only because it's a distal RCA. It's all right, and we've inflated the post dilatation to about 12 atmosphere pressure. You can see the distal stent has expanded well, and we have got no complaints here. So we're taking a long stent in the proximal part of the RCA, replacing the stent in the osteoproximal region, and I think the stent is being expanded well. And yes, see the stent expansion is being done. Some post dilatation in action. So we're post dilating the stent. The above stent was about 3 mm by I think 32 mm stent, and we're post dilating it with a 3.5 mm balloon. Wonderfully well, the post dilatation. And yes, we're using some live stent also. Anyways, the post dilatation, post dilatation, post dilatation, post dilatation. Anyways, wonderful artery has opened up, and we can see that the stent has the distal stent is also well opened up, and the proximal stent also. Good results. And let me show you the first. The artery was very narrow, and you can see the distal and the artery here. This was the artery before, and I think the artery has opened up quite well, nicely. Yes, and the patient is all well and is being discharged. Thank you.